3 times a week, Marco Antonio comes to this public dialysis center in Caracas to have his blood treated. He has been waiting for a kidney transplant for more than 4 years. Dialysis is his only option for now.
Hope is the last thing I have left. I haven't lost that. It is why I keep fighting and the reason I'm still alive.
His courage is not supported by a faith in Venezuela's healthcare system. The country's dialysis centers are crumbling. Broken machines and poor infrastructure, a lack of medical supplies and personnel are among the many hardships facing kidney patients.
We are afraid because we all know that this crisis that is affecting us can lead us to fatal consequences.
The uncertainty of getting a transplant has been going on for years. 4 years ago, the government suspended organ procurement from deceased donors. The reason for the temporary pause was the general deterioration of hospital infrastructure and the scarcity of post-transplant medication. The country's healthcare system was no longer equipped to process organs safely. According to the National Transplant Organization of Venezuela, more than 950 transplants never happened over the last 4 years. Both children and adults have died waiting for a kidney or liver transplant. A living donor transplant is the only option left, but even this option is currently only available at private health institutions. It's also an expensive procedure that costs thousands of dollars, putting the operation out of reach for most Venezuelans.
Quedaron 5,000 personas en lista de espera.
5,000 people were left on the waiting list. Many of them are not with us today. They died. If you don't have a living related donor and a large amount of money to pay for the transplant at a private hospital, you don't have any other alternative.
Tu alternativa no existe.
Jessica Solórzano, who is 36 years old, was lucky. 3 years ago, she got a new kidney from her brother. A crowdfunding campaign allowed her to pay for the surgery, but her worries did not end there. Today, she struggles to find immunosuppressants, a post-transplant medication that she must take for life. Such medicines are almost impossible to get in Venezuela.
I'm afraid of not getting my medicine because I know if I don't take the treatment, I will reject the kidney and I will lose all the efforts of the past 3 years. Coming back to dialysis is like a death sentence for a Venezuelan.
Whether you get a transplant or not, there are still no guarantees. Health experts have warned that approximately 3,000 post-operative patients are at risk of losing transplant organs due to the shortage and high cost of medicines. In Venezuela, a second chance at life can often mean no life at all. Triny, Mena, CGTN, Caracas.